Welcome, everybody, to Developmental Behavioral Pediatrics Live. I am Dr. Noble, Developmental Behavioral Pediatrician, Clinical Geneticist. You're watching maybe, quite possibly, the greatest developmental pediatrics show on the internet, likely because it's the only show on the internet. Let's take the sound off. Okay, everybody, let me bring up our agenda for today so that you know what it is you're watching and why it could potentially be beneficial to you. So the reason we're doing this is because if you're watching this, you got questions. You got a lot of questions, and maybe your doctor's referred you to somebody like me or to somebody who does some similar services to a developmental behavioral pediatrician, which I am. I'm also a clinical geneticist, and these services are remarkably difficult to access. And so we want to take the most common questions that we get on a week-by-week basis, okay? And we're going to put them together in a live internet show that we're going to do for you. That being said, it's not just for your viewing pleasure. It's also for you to ask your own sets of questions. This is live. If you put your questions into the chat, I will see them. I will bring them onto the screen, and I will do my very best to answer them. That being said, I also have a set of questions that we're answering from the last 7 days in the clinic, so there'll be something for everybody. So don't be shy if you have questions. That's why we do it live, is so that you can get your questions answered. So that is the first thing I want to say to you. So welcome. If you're watching this on the upload, put your questions in the comments and we will see that, and we will do our best to respond. And if this is beneficial to you in any way, shape, or form, like and subscribe. Not so that I can build the channel. I don't care. I don't care about that. You know what I do care about? Enhancing the visibility of this information so that single moms and dads, so that grandparents raising kids with special healthcare needs can see this, so that the algorithm will show it to them, so that they can be mutually encouraged. They can be educated, equipped, and encouraged to do the work of raising these kids. And the best way we can do that is to get you to like and subscribe so that they can find it. So let's talk today about our agenda. Okay, here's our agenda. Here it is. We're going to talk about bullying. All right. Now, I'm not going to solve this problem. Turns out that in our current day and age, this is still an issue. So if you're raising a child with a special healthcare need, if you're raising a child with a disability or a genetic condition, you've experienced this. And this was a great question I was asked over the last 7 days, and I want to tell you how I responded to it, to that family, and I think it should be some benefit for you there. We're also going to talk today about the 4 horsemen of frustration, right? Kids act certain ways for certain reasons. They do stuff for reasons. Now, understanding what those reasons are isn't always going to, magically fix your problems, but I think it opens up a broader dialogue about things that we can think about and questions that you should ask yourself as you address behavioral problems in children. The next thing we're going to talk about is transitions to adulthood. Again, this is just stuff that's fresh over the last 7 days. These are questions. If you got a 17, 18, 19-year-old kid, maybe they're on an IEP, or I should say a young adult, man or woman, and they're progressing in their IEP and they're starting to think about vocational rehab, and you have questions, I want to talk to you just real briefly about what I say to individuals who are beginning the transition process and what are some things that you need to think about. And then lastly, I want to talk to you about a common question that we're getting this time of year. Should I change medications? Right? You started out the year strong. Johnny's doing fantastic. All's great. Teacher's great. Everything's good. Conferences come. You start to get some, oh, by the way, emails. And so then you're going to call the clinic, a clinic like mine, maybe your primary doctor's clinic, and you're going to say, hey, is this a good time to change medications? We are going to talk about all of those things today. But remember, if you got questions, put them in the chat. This is your chance to get after it. But that being said, let's get started. I want to talk to you first about bullying, okay? Not an uncommon theme. I see it a lot. And again, as a developmental pediatrician, clinical geneticist, I deal with kids who are up against developmental hurdles. So these kids already, life is heavier for them in many ways, okay? And it's almost like insult on injury. We still have, a culture, a subculture within, many realms of life that children will target these kids. And you would think that we're beyond that as a culture, but if you're raising kids or you've been around kids or you've seen a kid, you know that we are not. So I had this recently asked to me in a clinic, and I want to talk to you about how I answered it. Okay. So the situation basically works like this. Maybe your child's got a shortening condition. Maybe they've got a motor tic, like maybe they have Tourette syndrome. Maybe they have anxiety, or maybe they have selective mutism. They're up against any number of different things, and they're in a locker room or they're in a classroom where the teacher's maybe not watching, and somebody says something dumb to them. Somebody says something dumb. Okay. This was a question that it was asked to me in the last 7 days. And again, this is how I responded. The first thing that I want you to teach your child to do. And okay, of course, let's zoom out for just one quick second. Of course, let's zoom out for a second. Are there things, all right, there's a question we're going to talk about in a minute, but are there things that we should do in addition to the things I'm about to tell you in regards to bullying? Yes, of course. You want to include the school. You want to start a dialogue. You want to draw attention to this, if there's an aide or a teacher or a principal or somebody. I mean, you don't want every situation that I'm going to talk about with you to be a situation where your child has to do some vigilante work where they have to stick up for themselves in every area of life. I mean, yeah, those are good skills to have, but we want to involve the necessary individuals. So that goes without saying. Okay. But those individuals are rarely present, okay, in the moment when the bullying is happening. So here's what I tell families to do, okay? And again, this is not new. These are not novel concepts. So you've heard this before. Just skim forward in the video. Okay, but here's what I say to you. The first thing that I ask children to do when they have, the ability to do it, right? When they have the developmental skill set to go through this series of things, this is what I tell kids to do. I say the first thing that you want to do when you know someone is bullying you, they're making fun of you because you're short or because you stutter or because you don't talk or because you don't understand. The first thing that you want that child to do is what I tell families to do is have your child ask the person to repeat it. Repeat that. I know. This is, you're like, well, wait a second here. Isn't there some kind of, shouldn't they just raise their hand and go to the teacher? Yeah, those are good things too. But I want your children, I want you to equip your children to be able to advocate for themselves as best as possible. And the quickest way to do that, when someone has slighted you and you know it, whether it's sarcasm or the rolling of an eye or a question that they already know the answer to, it's not just for kids, it's also for adults. The first thing you do in that meeting, in that locker room, in that interaction is you ask the offending agent to repeat it. Can you repeat that for me? I'm not sure I understood. I need you to repeat it so that I can hear what it is that you've said and that everyone around me can hear what it is that you've said. Very important, because right away, what you've done, you put a spotlight where? You've moved the spotlight away from the child who's being made fun of or criticized, and you tilt it back towards the person who thought they were going to get away with it. Same in the meeting, same in the offensive exchange that adults experience on a daily basis. But this is what I told this young person in the clinic. I said, when this happens to you next time, because you're being made fun of for whatever it is, I want you to ask them to repeat it. And you watch what happens. Now, of course, most times when you ask somebody to repeat it, the person who's trying to get away with it is going to get a little bit uncomfortable. But, a lot of these kids are going to try it again. Well, you're really short, or you really don't know math, or whatever it is, blah, blah, blah. And then the next thing I have children do as they begin the very long and arduous journey of learning to self-advocate, after you've asked them to repeat it, I then counsel children. I say, and once they've repeated it, I want you to lean forward and I want you to ask, can you explain that to me? Can you explain what it is that you mean by that? I would like to know. I'd very much like to know. I think all of us in this room would very much like to know what it is that you meant by that comment. Please explain it. And then once it's explained, if the offending agent is willing to even try to explain, the likelihood that they're going to put their foot in that mess again is not zero, but it's lower, right? One of the single best ways I've found to deal with bullying in children, when they have the ability to go through these steps, not every kid has the same skill set, so I want to be sensitive, is to turn the spotlight of criticism away from you, not to criticize in return, but to examine. Let's turn the spotlight away from the things that you're saying to me that are terrible, and let's put them back on you. Can you repeat that for myself and for the group? Because I'm not sure I heard it, and I'm not sure everyone else heard it. So please say it again, say it slowly, articulate your words, because I want to know what it is that you've said, because it must be important, because you seem to be pretty satisfied with it. Number 2, can you explain that to me? What is it exactly that you meant there? You do those 2 things. You equip a child to do those 2 things, right? No one's screaming. No one's reverse shaming. No one's coming at you. It's not, evil on evil. That's not what this is. It's just a gentle, loving clarification that results in a glorious way to self-advocate. Right? And children that I serve in the clinic, children that you're raising by watching this, life is not going to get easier, right? It's like a lot of these kids walk around with a backpack full of rocks. Life is harder for them than it should be. And you know who else it's hard for? It's hard for you as a parent, as a provider, as a teacher, as a grandparent, as a neighbor. It's hard. And I want you to understand that it's okay to acknowledge that it's hard, and it's okay to be sad about it sometimes, but you don't get to stay down. Life is not about living in such a manner that you never fall down. It's about having the strength to get up, to dust off, to get back on and say, can you repeat that? Can you explain it to me in the group? That is how I handle bullying. Hopefully that's useful. Here's a question from my good man, Dennis, who's a great human being. I don't know you personally, Dennis, but I appreciate your support for the channel, and I love your questions because they're always really smart. Okay, is autism neurodegenerative? Okay, so this is something that let's talk about it. We're going to talk about it. Okay, Dennis, I'm going to bring it up again so people know what we're talking about. Now, when you think about a neurodegenerative disorder, okay, first off, as a geneticist, I want to clarify our terms. When I think about neurodegenerative conditions, right, then the meaning of that term is in the name, neuro. So the neuromuscular, typically in my mind, the neuromuscular system is degenerative, meaning you're regressing. Okay. So when I think about regressive conditions, there are many to consider. Typically, the first thing I think about is metabolic conditions. These are multi-organ systemic diseases that slowly remove developmental skill sets from children. If you're watching this and you have a child with a neurodevelopmental, okay, I'm not saying neurodegenerative, a neurodevelopmental disorder, autism spectrum disorders, something is, heavy is something, like a non-specified genetic condition, to ADHD. I mean, there's all different, it's a broad range. But if you're up against this and you're concerned because you think your child has a developmental disorder, an unspecified genetic condition, here's what I want you to understand. Bad things are greedy. Remember what I just told you. Bad things are greedy. I bet I say this once a month, at least. People say, well, how do you know we shouldn't do robust genetic testing? How do you know we shouldn't do, metabolic testing? And maybe sometimes we should. And that's a topic for another day. But when we do genetic testing, okay, when we think about bad things, you have to first understand that bad things are greedy. Bad things don't just typically take speech. They don't typically just take fine motor. They don't typically just take personal, social, and emotional developmental skills. Now, can they? Yes. But remember, bad things, neurodegenerative conditions, unspecified metabolic conditions, regressive conditions, there's numerous of them. So you think about a child who goes backwards. Okay. Now, in autism, is there a period of time where a child can regress? Yes. Typically, that is between 18 and 24 months of age. Okay. I'm telling you stuff you already know, but typically autism can present in a regressive fashion. So you have a child who's maybe using single words or putting some single, maybe using more than a handful of words, turning to voice, smiling responsively, tracking with their eyes by, 15, 18 months. But then between 18 and 24 months, they lose those skills. And people will say, but wait, Noble, you just said that bad things are greedy. And that, they take things away. And I would say that's true, but those are sliver skills that are very important skills. And there is regression within those skills. But what I want you to understand is that autism, from my perspective, over 20 years of doing this, tends not to be regressive or a neurodegenerative in general. Okay, so what that means is there's a season of regression, which typically leads to concerns and surveillance and screening tools that are used and referrals that are made. And by the time kids get to me at 2 or 3 years of age, they're not still going backwards. They're starting a slow, steady climb forward. And if you're raising a child with an autism spectrum disorder, I want you to anticipate slow, steady progress. Okay, yeah, there'll be seasons of plateau, but plateau does not mean regression. Regression typically means something else is going on, particularly if it's regression that begins to take more and more skill sets. So, Dennis, that's a long answer to a very good question. From my perspective, autism is not neurodegenerative, meaning I don't anticipate prolonged seasons of regression. There may be seasons of plateau, but from plateau, we then can continue to build on learned skills on the long and arduous road to independence. So, from my perspective, no. If it becomes a neurodegenerative condition, meaning you're continuing to lose developmental skill sets in multiple spheres of development, remember what I said, bad things are greedy, then maybe, just maybe, autism is a feature of an underlying condition that has autism as a feature, but has other areas of involvement. And maybe autism is not the primary diagnosis. Maybe it's something else, a metabolic condition, and robust genetic testing is often required. Dennis says, okay, thank you. Thank you, Dennis. You're awesome. Next question. Here we go. The 4 horsemen of frustration. Here we go. Another question that I get in the clinic a lot is, Dr. Noble, I got my kid and they blow. And wouldn't you know it, we don't know why. It just happens. They're chewing gum, they're living their lives, and all of a sudden something shifts. The barometric pressure, their attitude, right? Something shifts in the atmosphere and they explode and nobody knows why. And then I say, hold on. Again, this is stuff from the last 7 days. I say, listen, I love you. I care for you. That's why we're doing this, okay? Let's talk about it. What are the 4 horsemen of frustration? You got to know what these are so that you can begin to put your child's behavior into categories. Now, understanding the 4 horsemen of frustration is not going to dramatically change your life, okay? But it will. It will ensure that you point yourself in the right direction, right? Nobody wants to get in a car and take a road trip that's 12 hours knowing that they spent the first 6 hours going in the exact wrong direction, right? A car ride with your children is bad enough, right? I can't take away the pain of parenting, but what I can do is ensure, by understanding the 4 horsemen of frustration, that you don't waste time. Now, you might have to drive that car over a mountain. It might be terrible, but I can assure you that as the crow flies, you're not wasting time. You're going in the most direct route, even though it's difficult. Number 1, the first of the 4 horsemen of frustration is disappointment. Another way to say it, unmet expectations. Unmet expectations, disappointment. You want to know why you blow? You come home from work, you come home from your job, you go to a meeting, something happens, you're in the Starbucks line. Oftentimes you blow because of disappointment, right? And it was an expectation that you didn't even know you had. This can explain a lot of marital strife, a lot of personal, social struggles, but it can also explain a lot of why kids explode. They had an expectation when they went into Walmart that you were going to buy them every Matchbox car that was there. Now you're thinking, Noble, I never told them I would do that. Where would they get that idea? You know what kids also think? They're also surprised every day by school. My kids are like surprised. They're like, what? I have to get out of bed and go to school. I have to brush my teeth. I need to go to bed every day? Yes, because children have unmet expectations, even if their expectations are wacko. Okay, I love kids. I love them. They're fantastic. But sometimes they get expectations that are wacko. So you can't help that. You couldn't have known that they wanted you to spend $10,000 every time you went into Walmart to buy them a pony, right? You didn't know that. You didn't know that. But the best way to deal with the first of the 4 horsemen of frustration is to identify as best you can the expectation before you go through the transition. And you have to clarify it. In this store, we have a limited amount of time and a limited amount of money. There are things that we can look at and not purchase. There are things that we must purchase for the good of our family. Anything that's not been discussed in this interaction between you and I is off limits. Okay. If you were to go off the cart and do the things that I'm telling you not to do, then we need to be removed from that environment and we need to transition away immediately. I know you know this. I know how dumb that sounds, but you would be amazed. People don't think that kids have expectations, that when they navigate disappointment, it does not go well. 4 horsemen number 2 is not disappointment. We talked about that. It's downgrades. It's demotions, right? It's going from something I like to something I like less. Let me ask you this. If I wanted to make you a runner, I'm not a runner. I can barely go up a flight of steps. I have low back pain and gray hair. I'm 48 years old. But hey, if I wanted to make you a runner, okay, the first thing that I would want to think about is running a good next step for you, right? Is this something that fits into the pantheon of things that can enhance your life? Is this necessary, right? And if I wanted to make you a runner, there's a few ways I could do that. I could show up at your room, in your bedroom at 5 a.m. and dump ice cold water on your face, right? Or I could meet you at, the workout facility, and then we could stretch together and sit in the sauna and get our muscles worked out. And then maybe we could set a time on how far we're going to run and blah, blah, blah. One is like an immediate transition from something you like, sleep, to something you like less, ice water on your face, right? Kids, when they go through downgrades or demotions in their preference profile, explode. Because even though for us, it's like, well, what's the big deal? You're just coming in from the cul-de-sac to have dinner. Dinner's good. What's the big deal? You're clearly tired. Bedtime should be a high preference transition for you. But as I've said earlier, children are not us. Children don't think the way we think. They don't have preferences or priorities that make sense. And I love them. But if they could eat gummy bears every day, they would do it. And I'm telling you the truth. You and I would not. I wouldn't get up in the middle of the night and look at YouTube videos. No, I would sleep. But kids are not like us. So if you're dealing with a child who's exploding because of a downgrade or a demotion, a high preference to a low preference transition, the first question you have to ask yourself is this necessary? Is this a necessary transition? Okay. I know that sounds dumb, but so many people come into the clinic and they say things to me like, well, Noble, in our family, we do this. And I say, listen, I love that you've got a thing about your family and what that means. But when you appeal to a standard that is your family, which again, not bad or wrong, but you derived that standard from something, and it was probably something unrealistic. A sitcom, people who live across the cul-de-sac, a Laura Ingalls Wilder book where everybody wears like denim clothes and reads books by a fireplace and grows vegetables. You know what I mean? Like, what standard are you appealing to when you say our family? Because that standard needs to be challenged sometimes when you're dealing with a child who has a neurodevelopmental disorder or is explosive or irritable and you're up against it. Okay. So when you're asking a child to downgrade, to go through a demotion, the first question you have to ask yourself is this necessary? Right? Do they need to come in from the cul-de-sac and immediately put their shoes away and immediately do their math homework? When they get off the bus, do they immediately have to unpack their lunchbox and immediately have to do whatever arbitrary chore that they should do? But the question is it necessary at this moment in time? And then the second question you have to ask yourself is, what's the time frame that this thing that you're asking them to do needs to be done? Okay. Because again, like if you're me, you're like, what's the big deal? You just take your shoes and you put them in a thing. Like, what's the big deal? You're sleeping and I dump ice water on your face. What's the big deal? Right. Well, for a kid, it's a big deal. And I'm not trying to make this kid centric and like, well, if little Johnny doesn't want to do stuff, then we're not going to make him do stuff. That's not what I mean. Okay. I'm not advocating that we raise a generation of children that thinks the world is completely and totally about them. Oops. We don't want that. Right. But what is the time frame? Is it immediate? Is it an immediate thing that needs to be done? Now, are there immediate low preference transitions that need to occur? Yes. Let me give you an example. Johnny's playing with a ball. He's having so much fun. The ball bounces into the street. Now he doesn't want to stop chasing the ball, but you see a UPS truck going 800 miles an hour down the road. And that is a low preference transition, meaning Johnny can't run into the street and chase the ball. And the timing of that transition is immediate. It's right now. It's today. So Johnny gets a no, a stop, a don't, right? There's several ways to get down a skiing hill. There's several ways to get down a mountain. You can go the bunny hill route, right? Which is a little bit less dicey, or you can go the black hill, the black diamond, the double black diamond. They both get you down the hill, one's with a lot more bumps and bruises. So many times we make a low preference transition, a demotion for a child. We want to make it immediate because it works on our timetable, right? I'm not saying they don't need to make low preference transitions. What I'm saying is don't make life harder for you. Being a parent is one of the hardest and most glorious things that you'll ever endeavor to do in your life. Don't make it harder. Why does Johnny have to do the low preference transition right now? Why is it always a black diamond for you, right? If the shoes get put away sometime in the evening, maybe that's okay. Now, how do you do that? I'm going to talk about that next, but ask yourself, is this necessary? If the answer is yes, then okay, it's a safety issue. It's a betterment of the family issue, and you have to enforce it no matter how Johnny feels. If the time frame is a little bit more generous, it's not immediate, right? You don't have to yank them out of the street. You don't have to pull them away from the beehive. Then you've got a little time on your side, and it's time to be smart. Because yes, I want the transition. I want the downgrade. I want the demotion to happen, but I want it to happen in a way that causes you the least amount of trouble if you have time on your side. And I would like you to consider a U-shaped preference curve. A U-shaped preference curve. Here's what I mean. Okay, so down at the bottom of our curve is the thing that I hate. Okay, I don't want to do this thing. Okay, up here is me playing in the cul-de-sac, and maybe at the bottom of the curve is me putting my shoes away, and then maybe up here is, I'm having dinner, I'm taking a bath, right? Something that I don't, it's not terrible to me. It's like, so it's a U-shaped transition curve. So many times we want to go from you're doing something you like straight down, right? You got to get out of this building. Don't take the elevator, don't take the stairs, just jump off the building. It's a lot quicker. Yeah, but I feel like the outcome is less advantageous. I feel like it's going to be hard to, it's just going to be hard to move forward from that, right? Don't make parenting a jump off the building every time you got something that needs to happen situation. Don't do that. You're too smart for that, okay? Parenting is not checkers, it's chess, right? You got to let them take some pieces sometimes so that you can take their queen and their king, whichever one you have to take to win the game. I don't really know. I'm not smart enough, but it's chess. Think steps ahead. It's okay if they take a pawn. It doesn't matter. So you think about a U-shaped transition curve. You're outside. You're doing something you like. I've acknowledged that this is a necessary transition, but it's not an immediate one. Okay. The demotion has to occur. You do have to come inside. You do have to brush your teeth. You have to be part of the family. So if I'm here, maybe what I could do is introduce either a neutral transition. So something that you don't hate, but you don't love. So that moves you a little bit down the preference curve, but you don't hate it, right? Something like, you know what? Right now we're playing in the cul-de-sac. Let's shoot some baskets for 10 minutes. Let's play a quick game of horse. And then let's come inside and we're going to wrestle for 4 minutes. And then as we get ready to go and wash our hands to have dinner, let's just pick up these shoes. Now we're at the bottom of the preference curve. Let's just pick up these shoes. We'll throw them away. Do you see what we're doing? We're not emphasizing the thing that we hate. We're emphasizing neutral transitions or maybe slightly lower gradations of preference as we get down to the thing that we hate, right? It's me getting you out of bed and stretching with you in a sauna before we go and run in January in Iowa at 5 a.m. for crying out loud. You don't want to go from 0 to 60, from 13th floor to parking lot, from top of the mountain, Black Diamond to the bottom. Take the bunny hill if you can. Insert the low preference in the middle of a bunch of neutrals and then swing back up to something else that the child may enjoy. Okay. So it doesn't have to be playing in the cul-de-sac, but it could be something like after we put these shoes away, we wash our hands, we have some dinner, we'll clean up. We're going to play some Monopoly. Okay. So now we're back up here again. Maybe we'll watch 30 minutes of a show. Maybe we'll play some Uno. We'll do something like that. And then I'm going to tell you the most amazing story you've ever heard. And then we're going to say some prayers. I'm going to remind you how much I love you. And you're going to go to sleep unconditionally loved. Okay. So if you have time on your side, you don't have to go from A to E. You can add a B, C, and D of intermediate or neutral transitions along the way. Because at the end of the day, as long as the work gets done, as long as the downgrade occurs, as you are still in control, but you just don't look like a raging lunatic on the journey. Okay. Man, that was a little bit longer than I wanted. The third horseman of frustration is discomfort. And this is what we're going to call the terrible triad. Kids get hungry, kids get tired, kids get cold. Okay. Just if any two of those three things are occurring, you're in big, big trouble. So So address it. Okay. That's an easy one, right? But sometimes they have other things. Sometimes they're constipated. Sometimes they have discomfort because they have obstructive sleep apnea, or they're tired. Sometimes they have discomfort because, they have an undiagnosed condition like anxiety, or they have a teacher who screams at them all the time. Like, you just have to zoom out. Sometimes they're acting certain ways because they're uncomfortable. They're not, so that's not the time to be a great parent and to do a U-shaped preference curve and, really decide if this is it. It's time to go see your regular doctor. It's time to have a conversation with your teacher. It's time to revise the IEP or the 504. And then lastly, the last of the 4 horsemen of frustration. Okay. When you're dealing with children who are behaving poorly, you got to ask yourself, which of the 4 horsemen am I dealing with here? Okay. Now, I'm not telling you what to do with these behaviors. Okay. We're going to talk about that in a minute. But you have to ask yourself, how am I going to address which of these 4 horsemen it is? And the 4th one is denial. Someone tells them no. The 4 horsemen, the 4th of the 4 horsemen is denial. Someone says, nope, not going to do it. I met a family once, lovely family, great family. And we were talking about behaviors, and I said, well, tell me what happens when you tell them no. And the family was like, they got very uncomfortable. This was years and years ago. And they're like, well, we don't really use that word. And I was born in 1976, raised in the front bench seat of a Chevy pickup truck with no seat belts. You know what I mean? Like, I just grew up in a different generation. So I was like, that's the word you choose to outlaw in your house is no. So I said, so what happens when they run in the street? What do you say? What happens when they take a fork and they put it in the outlet? What's the word that comes out of your mouth then? What happens when there's a rattlesnake and they're like, hey, let's see if I can be friends? The answer is probably no, right? Kids should hear the word no. But if you're struggling, whenever you tell your kid no, I'm going to tell you something. This is gold. This is internet gold. That's why this is the greatest developmental pediatrics live show on the internet, because it's the only one, is because you have 1 or 2 problems. Number 1, you have to ask yourself, is this a good no? Is this a good no? A very, very smart behavioral psychologist told me once that you should say yes 4 times more than you say no. And you're like, well, good luck with that, Noble, because you don't understand my life, because I have a Tai Chi class at 5, and we have competitive soccer at 6, and then we have math tutoring at 7, and then I do self-loathing and fear from 8 to 9, and then I watch a bunch of TikTok videos and fall asleep at 2 a.m. Listen, okay, is this a good no? I know your life is crazy. But maybe the story starts with you making it less crazy. Oh my goodness, I need to talk about this next week. You have my permission to not enroll your kid in every single thing. You want to know the single most common factor that families that are coming apart, you want to know what, from my perspective, 20 years of doing this, they've got too many choices and they don't know which ones to say no to. Listen, I'm sure your kid loves competitive soccer. I'm sure they do. Well, we loves it, Noble, so we like to go to Holiday Inn and drink Chulias by the pool with people we don't like every week. What? How are you working on family stuff when you're eating dinner 4 nights a week in a Chick-fil-A drive-thru? How are you working on your family? I'm not being critical, okay? I'm just saying people bring these problems to my clinic and I take my finger and I put it right in the wound and I say, maybe Johnny's not going to be a professional soccer player. Statistically, he's not. Statistically, you do not have a Division I athlete in your house. Okay. I've met many of them. A lot of them aren't even athletes anymore because they don't even want to. They got so burnt out. But you know what you never get burnt out of? Being a family. So for crying sakes, the question you have to ask yourself is, is this a good no? Can we go outside, Dad? It's raining. You haven't been with your kids all day. You're still in a business suit. You've got dinner to cook and you've got emails to read, but you haven't been with this kid all day. You can get your clothes laundered. Okay. You can get them laundered. You can go and buy new cheap clothes at Costco. It does not matter. Yes, you're going to want to say no because it's raining, or no because it's snowing, or no because I'm really important and I manage people at work. But if you could is that really a no you need to use? Maybe give them a yes. Maybe give 4 times more yeses than no. You will give them 4 times the memories. Okay. Is this an important no? And the second thing I want you to think about when if your kids are blowing. So if they're blowing, ask yourself, is this a no that I should really advocate for or not? But then the second mistake people make with no is what we're going to call the inflation of no. Oh yeah. You want to know what happens when you print a bunch of money and you flood it into an economy? Inflation happens. I'm not very smart with stuff, but I'm just telling you that's my general sense. Okay. From lemonade stands to macroeconomics, you can't just print money. Doesn't work. It's the same with no. If you say no all the time in your home, all you do is say no. Dad, can I go outside? No. Dad, can I do this? No. Dad, can I do this? No. Guess what happens to the value of no in your home? It becomes inflated. And guess what? It loses its value. And then they stop hearing it, or they anticipate that that's all you're going to say. Don't let the legacy in your home, don't let this brief window of time you have with your kids don't let the arc over your family in this season of life be no. There's things that you should say no to. Dad, can we have a pony? No. Dad, are you ever going to leave me? No. They should hear that no. They should resoundingly hear that no, because they're used to hearing yes, 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 because you can get your clothes laundered and you can go late to a meeting and you can quit competitive soccer, okay? But don't flood your home with no, because your schedule is dumb, because you have no bandwidth. If you have no bandwidth and you're at the end of your rope, you got to quit stuff, okay? You can't quit family. Don't you quit family, but you can quit stuff, because it's probably not going to lead where you think it's going to lead. And truthfully, you're going to spend less time around people you don't like. Ask me how I know. Okay. Next, transition to adulthood. This is another big question. People ask it. People ask it a lot. I've got a 17, 16, 18-year-old person, and they come to the clinic and they have a special healthcare need, or they have a condition that's going to make a complete independence a challenge. What I say to them is there's a few things to think about. Number one, the transition to independent adult with children who have special healthcare needs or developmental obstacles starts at 12. I'm going to say it again. It starts at 12. Now, do I value Eastern European religions? Yes. Do I value knowing the historical relevance of World War II? Yes. You know what else I value? Knowing how to make change of $1. Yep, I do. Turns out I do. I value knowing how to do laundry. I value knowing that you shouldn't put things made of metal in a microwave, okay? Because these are things that independent adults need to understand. They need to know how to read road signs. They need to understand time schedules for bus routes, okay? Now, I'm not saying you don't continue to advocate for children to build on learned skills and learn as much as they can, but at 12, you have to start asking a different set of questions. Where do I see my child residing after graduation? Where do I see them living the best years of their life? And if your goal is not autonomy, it should be. And autonomy is a mindset. You know what it starts? I just said it starts at 12 academically, but you know where it starts? With me, in my clinic, it starts the minute I talk to you. You're 12. You got a kid who's 2, got a kid who's 1, you got a kid who's 4. And I say, listen, I don't know exactly how your child will talk, or how they will walk, or how they will live, or how they will meet their own needs independently. But one thing I do know is that we as parents and as adults should endeavor for that reality to whatever extent possible. Okay, we should squeeze every drop of potential out of our children in the therapies and services that we receive, in the evaluations that we seek, in the partnerships that we form with our healthcare providers. We should have one unifying goal, and that's the highest level of independence. And that's a challenge for a lot of people. People struggle with what I just said. They struggle. They don't want to hear that, and it's for good reasons. I'm not being critical. They say things like, well, I'm worried people will be mean to him, or he's not able to express himself with words. And so how will I know if people are bullying him? And then I say, you know what else is going to likely happen if you don't send him to school, or to birthday parties, or to bar mitzvahs, or to the trampoline park? You know what else is going to happen that I guarantee you? People are not going to receive the blessing that is your child. People don't think about it that way. All they see, and it's couched, it's hidden behind a thin veil of altruism and love that I respect. I do. But I want you to receive this. The world needs and deserves to be blessed by your child. All their bumps and bruises, all their outburst behaviors, all their self-stimming, all their spinning around, all their explosions because they didn't get the red candle and they wanted the red candle. Who cares? If you're around people who can't tolerate that, then you're around wrong people. If your life is is a sum total of people who follow your children around when they come to their house and they say, oh, no. They use a lot of inclusive language like, well, we don't jump on the couch, or no, we don't play with the doilies. If you're around people who are using that kind of instruction to redirect your children, then you're around the wrong people. Come to the Noble House. Right now, I got a hole that's probably, I don't know, almost 12 inches wide that one of my kids put in it just the other day because they kicked the wall trying to do a karate move. Like, who cares? You can fix a wall, right? Walls are easy to fix. But true friendships are durable and lasting, okay? So, but I got off track there. The path to autonomy and independence begins immediately. And it begins with the parents, not with the child. I saw a family once. I'm going to tell you this story because you're here and this is the greatest developmental pediatric show on the internet. I saw a family one time in the clinic. Child, he was maybe 12 years old in a wheelchair. Okay. He had cerebral palsy. It was time for the physical exam. He locks his wheelchair in place because he wanted to show me that he could walk. He wanted to show me that he could walk from that wheelchair to the exam table. So he locked his wheelchair and he got up and he took a couple steps and he looked up at me like, see, Noble, check me out. Look how awesome I am. He was kind of hunched over. He had really tight heel cords and just tight hamstrings. He was kind of hunched over and he tripped over his 2 feet and he fell on the linoleum floor. And it was like face first, dead body hits the floor kind of fall. He hits the floor and out of the side of his face, I can see this little stream of blood. I'm a new developmental pediatrician. I'm still trying to understand the strength and the perseverance that people like you have as you endeavor to raise kids that are going to be world changers and blessing to the community and blessed by the community. And I am doing everybody on this live stream would do. I do the exact same thing you would do. I'm a dad. You're a dad. You're a human being. What do? I push my chair away and I get up out of my chair because I'm going to go pick that kid up off the floor. What does the mom across the exam room do? She doesn't move. She does not move. She looks at me, snaps her fingers. I'm 34 years old at that point. I'm triple board certified. All right. I have a developmental center. I'm the medical director of. You don't tell me what to do. But she does. She snaps her fingers. She points at me and she says, sit down. And then she points to the kid and she sits in that chair and she looks at me and she says, he can do this. And we waited. And I sat there for what felt like an hour as this kid slowly he had spastic diplegic cerebral palsy, like his lower extremities were very affected, very tight. He pushes himself up off the floor. He climbs back into the wheelchair, straps himself in, wipes the blood off his face, and looks me in the eye and gave me a look that I will never forget. And it was dignity. It was dignity. Never forget that. Give your child the gift of dignity. They can do this. Give them the strength to do it by believing in them. Bet on your child. All chips go to the child every time. Okay. Back to what I'm saying. Guardianship. If you got a 16, 17, 8-year-old kid, you're thinking about the path towards adulthood. It starts at 12 with a discussion with the school about vocational rehab services. Okay. You got to be loud. You got to be aggressive. Some schools have really good connections with voc rehab. Sometimes they don't. Okay. But they want to. I'm not criticizing schools. So you got to start making calls. You find the vocational rehabilitation centers in your state and you start calling them. You say, I got a kid. He's got some skills. He needs some job experience. What do you got for me? And they'll be like, well, 12 is a little bit too young. You're like, nope, I listen to the greatest developmental talk show host in the world. And he said it starts at 12. It starts at 12, right? It's a time for you to have an awkward conversation with school and say, listen, Eastern European religions are really important. I love them a lot, but Johnny needs to learn how to make change as well. Well, he's not meaning that's not according to our curriculum. Like, look, I don't care what your fast testing shows. I love you, but this kid's going to live an independent life to whatever degree is possible. And he needs to know how to not get ripped off at a movie theater. So let's put that in there too. Okay. And then once they get closer to 17, 18, once they get to be an adult 18, you have to think about whether or not your child could meet criteria to go under your guardianship. Okay. Now, I have a separate video on that. I'll link it below, where I talk to a financial advisor who specializes in helping people understand how to move assets around to make sure that their children under your guardianship have assets for the rest of their life. Okay. So I'll link that video below. But vocational rehab, guardianship. So you have to meet with the lawyer. You have to go through the steps. That way you can kind of continue to control your child's finances on their behalf, among other things. Asset management, which I talked about. And again, I'll link that video below. So those are some of the big ticket items. It's a much longer conversation, but I wanted to bring it up. Here's a question that Andy's always great to hear you speak. Andy, that's not really a question. It's a comment. And I love it because you're amazing. Thank you for doing that. Okay, Julie, that's very nice of you. I would love, and I'm going to, Julie. So this is happening, and I'm going to get that at the end. Okay. Okay. Here's not according to our curriculum and not how it's done. Need to be removed from schools for the sake of all children. Could not agree more. And whenever I agree with these things, I run the risk of sounding like I'm not for schools. I love schools. Huge fan of schools. Overworked, underpaid. But Stacy, I absolutely agree with you. It's not a raising of the white flag. No one's raising the white flag and saying, well, I guess he's not able to learn about Eastern European religions. Well, that's not what we're saying. What I'm saying is there are firsts and thens. Okay. Let's do the first things first. All right. If our stated goal is independence, autonomy to whatever degree is possible, then we have to take steps towards that end. If your goal is to lose 40 pounds, then your day has to start a certain way, probably the night before with meal planning or exercising. Everything you do in your present needs to reflect the reality of the future that you have agreed upon. Okay. Wishful thinking is not what's going to bring your child to independence. So thank you, Stacy, for your thoughts. A teacher myself, totally get it. Awesome. Thank you for being a part of this. Last thing, this has gone much longer than I thought, but I've really enjoyed this. And I sincerely hope that you receive education, equipping, and encouragement. That's what I'm trying to do here. And that's why we're doing these videos, because otherwise, for you to hear this spiel, you got to sit on my wait list for 12 to 18 months or another developmental pediatrician's wait list for 12 to 18 months. And maybe it's not even a good fit. So we're just going to get this stuff out here every week on Thursdays at 9. Next week, of course, it will be recorded because it's Thanksgiving. But let me go to the last of our topics for today, and then we will be done. Is this a good time to change medication? Okay. Let me tell you, let me explain this to you, my friends. There are two hurdles when it comes, there's three. There's three hurdles when it comes to deciding medications for children. The first of which is this child impaired enough to warrant medication? What kind of kids get medications? Let's talk about it. Not kids that are annoying, not kids that are frustrating, not kids that are acting like little rascals. It's kids that are impaired. It's kids that are sad. Their lives are a dumpster fire. They can't be successful in an environment. They can't build on learned skills. They're trying the best they can. School's doing a great job. IEPs are maximized. 504s are in full and focus. You're doing the best you can. Those kids, when you're on fourth down territory, that's a good time to consider medications in general, whether it's for ADHD or anxiety or whatever it is. Okay. So, but once you've crossed the first hurdle of, is this child impaired? The second hurdle is, are you willing to take a medication? Now, please understand that when we prescribe a medication, let's take ADHD medications as an example. I did not blow through all of my 20s and half of my 30s just so that I can ride around in a white van with a bunch of doctors and pull up to playgrounds and throw pills in kids' mouths. That was not my goal, right? But if I have the ability to really help somebody and change the trajectory of their life, I'm going to do it. But what you have to understand is, once we've verified that a child is impaired, the second thing we do is we use medications that are evidence-based and are best practice. These medicines are not going to hurt your children. People think they will. They're not going to make zombies. I'm not trying to create a generation of pharmacologic zombies. Okay. we're using the least amount of medicine to get the most amount of benefit. All right. But then once you understand impairment and you've bought into the idea that these medications are safe and effective and should be used, that's a second hurdle. Then you get into the third hurdle, and that's the management, that is the management hurdle, which is medications need to be adjusted, and parents struggle here. They're like, well, it's hard enough to get me to say yes to taking a medication, and now you want to go up on the medication? And I say, listen, if there was a code situation, a child's dying, I've seen this many times, in a code situation, all right, everybody in the code has a job. If you don't have a job, where should you be? Not in that room. We don't need voyeurs. We don't need people watching because they took care of a kid one time and they feel really bad and they looked at the chart and know the kid's first name. No. You have a job or you get out. Medications do things or they get out. So if your child's on a medication and it's not working, we are going to optimize that medication, which is doctor speak for increasing it. Now, I never say that I'm increasing in medicine. Okay, I'm not trying to trick you, but nobody wants to go to the doctor and be like, yeah, what happened? Well, the doctor increased the medicine for my child. Nobody likes the way that sounds, but you know what they do like? Optimizing. I want to optimize my miles per gallon in my 2014 Toyota Sienna minivan. I want to optimize things. I want to optimize my health and well-being. I want to optimize your child's pharmacologic regimen by optimizing the dose. Sometimes they outgrow the dose. Sometimes we need to manipulate the dose to better reflect their current strengths or their current weaknesses or their increase in growth. But that doesn't answer the question. The question here is it a good time to change medications? And by time, I mean right now. So your child started out the year well. Things were great. Everyone was celebrating. There was ticker tape parades and a bunch of gold stars. And then the newness of school wore off. And then conferences happened and there was kind of some, not super reassuring feedback from a very well-meaning and excellent teacher. And now you're getting phone calls or emails from the principal every day. Okay. That's the typical academic progression of medications that do need to be addressed. But the question at hand is this the right time to do it? After conferences, before the holidays? Well, I'm going to say in our clinic, what we're trying to do is what I'm saying to a lot of people is not right now. Why? Okay, why? Because if you think about behaviors and you think about individuals' response, one of the base level or platforms that help kids respond well to these medications, okay, is structure. Okay. So if you change the structure, right? So a substitute teacher comes in or school is done and now you're on Thanksgiving break, you're going to optimize the medication, but the structure of their life is completely changed. So how do you really know if the medication change was effective? Because you're not measuring apples to apples, right? In a week, your child's going to be off for 4 days. And then they're going to be in the slow descent into, chaos until the Christmas comes and they get a bunch of presents that they don't deserve and aren't thankful for. Okay. And so then they're off for like 2 weeks and maybe they're on an optimized dose of a ADHD medicine. And you're gonna be like, well, this medicine doesn't work because they're unthankful and mean and out of sorts. Like, right. Because the schedule has changed. The curriculum has changed. The circumstances have changed. So it's typically not a great time to change medications right now. I'm not trying to be mean, but I'm just letting you know. Are there times to do it? Yeah, maybe over Christmas break, depending on what we're treating. But again, not a great time for most things. The best time to do it is maybe towards the end of spring break, early January, so you can measure apples to apples, send some forms to school, get a sense for if this medication on an optimized basis is best or if we need to switch completely. There is we're putting out some Black Friday. That sounds silly to say that, so you know what that means. But we are rolling out a course on how to assess and address behavioral problems in children. It's called Assess and Address in 60 Seconds or Less. And it's going to be pretty fantastic. And come back to this video because I'm going to put the link in below if you want to get in and enroll for that early. I promise you. Is it going to fix the behaviors in 60 seconds? Nope. But you're going to learn about the 4 horsemen. You're going to learn about the functions of behavior, and you're going to learn about ways to navigate behavioral interventions based on the functions of behavior so that you don't spend 15 hours driving in the wrong direction. I can't promise you won't have to drive in the right direction up a mountain. And I can promise you also that these behavioral problems will not just go away when we put these things in place. But I am going to teach you what I teach families over the last 20 years on how to at least point your ship in the right direction. And you can also see that information on drnatenoble.com, which is where we're rolling out courses, and we have a newsletter. Go sign up for that and blah, 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 all the stuff. Okay, listen. It is an absolute pleasure and honor to spend this time with you. Please put your questions on the upload in the comments, and I'll see them, and we can address those questions in weeks moving forward. We endeavor to do this every week, 9 a.m. Central Standard Time, and I look forward to seeing you next week. So if there are no other questions, I'm going to phase in my 80s music and end the stream. Thank you all for your time, energy, and resources. It's been an absolute pleasure. I'll see you next week.